Hello, and a very warm welcome. Today I really wanted to create a safe, gentle space to talk about something that so many of us have questions about, and that's vaginal health therapies. We're going to explore how different treatments can actually work together, hand in hand, to support your comfort and well-being. So let's just dive right in, shall we?
So, this is probably the number one question we hear, and it's such a good one. It's completely understandable to wonder if you can, or if you even should, combine something like a laser treatment with other things you might already be using, like moisturizers or maybe a prescribed estrogen. It's a really important question for your own personal health journey. And I'm so happy to say that the answer, which I hope brings a little sigh of relief, is a simple and definite yes. It's a common worry, that different treatments might clash or interfere with each other. But the truth is, when they're guided by a specialist, they're actually designed to work together for you. And it's more than just possible, it's often the very best way to get the results you're looking for. The goal isn't just about treating one single symptom, it's about supporting the entire health of the vaginal tissue in a really holistic way. This brings us to a really beautiful concept. It's called synergy. And all it really means is that when we bring different supportive treatments together, they can create a result that's so much greater than what any single one could do all on its own. So the key takeaway here is that synergy in vaginal health isn't about just randomly layering treatments. No, it's about thoughtfully choosing therapies that work on different complementary pathways. Each one brings its own unique strength to the table to support your body's health. This table really shows what we mean by that team effort. So let's look at each one's special role. You have laser or radiofrequency, which works deep down to gently wake up your body's own collagen-making and repair systems. Then there's vaginal estrogen, which is brilliant for restoring tissue thickness and that healthy pH balance. Moisturizers, they give you that lovely, immediate surface hydration for day-to-day comfort. And finally, something like platelet-rich plasma, or PRP, uses your body's own amazing growth factors to supercharge that natural healing. See, each one plays a really distinct and valuable part. Okay, so let's see how all this comes together in a real-world plan. And this is so important to remember. This is never a one-size-fits-all thing. Any combination plan is always tailored specifically to you. Your body, your symptoms, your goals. Your comfort is always the top priority. So let's talk about some of the most common combinations, starting with things you might already be using. With moisturizers, the guidance is wonderfully simple. You can usually use them right up until about 24 hours before a laser session, and then you just start again about 48 to 72 hours later to help soothe the tissue. And if you're using a prescribed vaginal estrogen, well, they're highly compatible. In fact, estrogen can actually prime the tissue, making it healthier and even more responsive to the laser. And don't worry, your specialist will lay out a super simple, clear schedule so you never have to guess about what to do when. Now, another really powerful option is combining laser with what's called platelet-rich plasma, or PRP. This is a regenerative treatment that uses the healing power that's already inside your own blood. Basically, the laser session creates this perfect opportunity for repair, and then the PRP, which is often done right after, delivers a rich concentration of your own growth factors to really amplify that healing response. It's a beautiful way to enhance your body's natural abilities. And of course, your safety is absolutely number one, so you would always discuss your full medical history first. Now, an approach like this is really only as good as the philosophy and the person behind it. And at the Women's Health Clinic, this compassionate, holistic philosophy is guided by Dr. Farzana Khan. Her entire practice is really built around empowering you with knowledge and creating a true partnership in your care. And this quote just says it all, doesn't it? In our own words, it's all about clarity and teamwork. And shared decision-making means you are always at the center of the conversation, making sure you feel competent and truly heard every single step of the way. This patient-first approach is backed by over 20 years of dedicated medical experience. Her specialist training in sexual and reproductive health means she has such a deep, nuanced understanding of these concerns. And the fact that she trains other clinicians, well, that just shows her commitment to raising the standard of care for all women, not just her own patients. Now, it's completely normal to have worries, or maybe you've heard conflicting information out there. So let's just take a moment to gently address some of the most common myths and replace them with some clear, gentle truths. Okay, so a frequent worry we hear is, will using estrogen stop the laser from working? And the truth is, it's quite the opposite. Estrogen actually improves the quality and hydration of the tissue, which can make the laser more effective. They really are a supportive team working together for your benefit. Here's another common thought. If I need more than one treatment, does that mean the first one isn't working? Oh, absolutely not. Think of it like a good skincare routine. You wouldn't just use a cleanser and expect the same results you'd get from using a cleanser, a serum, and a moisturizer, right? Combination therapy isn't a sign of weakness, it's a sign of a really strong, sophisticated, and holistic plan designed for the best possible outcome. So, what does this path forward actually look like when you put it all together? A holistic care plan is really just a clear, manageable, and supportive journey that's mapped out with you from the very beginning. This slide gives a really beautiful example of what that journey could look like. It might start with a few weeks of using estrogen if you need it, just to prime and prepare the tissue. Then you'd have your first laser session, maybe with PRP included. In the weeks between sessions, you'd continue your supportive home care. And finally, you move into a long-term maintenance phase, maybe with a simple annual top-up to sustain your comfort and results. It's a structured, predictable, and supportive path. And a wonderful part of this journey is that there are simple things you can do to support your body's healing. Things like staying well hydrated, avoiding any harsh or perfumed soaps, practicing some gentle pelvic floor awareness, and just allowing your body a few days to settle after a treatment. These are all small, empowering acts of self-care that truly make a big difference. And so, I just like to leave you with this gentle thought to carry with you. Now that you can see how these therapies can work in such beautiful harmony, what could a truly holistic and supportive approach to your health feel like for you? Just imagine that feeling of comfort and confidence. Thank you so much for sharing this time with me today.